Hello, this FERNE video addresses the issue of emergency department patients with dizziness and vertigo with the goal of diagnosing and treating serious central etiologies. This video addresses the vertigo patient bedside physical exam. My name is Edward Sloan. I'm an emergency physician in Chicago, and I serve as the FERNE president and board chair. I have no financial conflicts, and please go to our FERNE.org website or our YouTube channel for more information on this and other topics related to neurological emergencies. So, the dizziness, vertigo, bedside physical exam. This information comes from the EB Medicine monograph titled The Timing and Triggers Approach to the Patient with Acute Dizziness. It's a great piece written by Dr. Jonathan Edlow. We're now going to talk about the clinical pathway for the diagnostic evaluation of patients with acute vestibular syndrome. In other words, patients who have constant vertigo that is present at the time they are seen in the emergency department. The question is, are there any of 5 important physical exam findings that would suggest a central etiology to this vertigo problem? So, let's take a look at the vertigo, stroke, or TIA findings. That is, those findings that would suggest a central etiology related to ischemia or infarct. So, this addresses patients who have acute vestibular syndrome or spontaneous episodic vestibular syndrome. In other words, they have episodes where they become profoundly dizzy, or they have profound dizziness and vertigo at the time of evaluation. 5 tests are performed with these central symptoms in mind: abnormal nystagmus, vertical skew deviation, no unilateral hit exam, meaning their hit exam shows no abnormality of either vestibular syndrome or system, stroke exam findings that are worrisome, and ataxia. So if any of these 5 findings are found, a posterior circulation stroke or ischemia is likely. So again, what are we talking about? Central pattern nystagmus, which we will discuss in another video. Skew deviation with vertical correction noted. Negative or no unilateral correct saccade on the HIT study. CNS signs on neurological exam. And the patient is unable to sit or walk unassisted. All of these, any one of them, will point to some central etiology of the dizziness. So, we know now that there are 5 findings that are most important, and that if any of those 5 of those shows an abnormality, it suggests a central etiology. Conversely, if you want to assume following evaluation that the patient does not have a central etiology, you will need to make sure that all 5 of these exam findings are not present. If you have comments or questions about this or any other FERNE content, please get a hold of us at ferne.org, at gmail.com. Thank you for your time and have a good day.